we don't want to experience the complications of physician concern, but Murphy's law said that if it can happen, it will happen. So we have to bail out. So I'd like to show the three cases. First, broken tibial guiding sheath. Second, stack of wire and balloon catheter. Third, fractured IV catheter cell. First case, 4.5 guiding sheath was introduced into the CFA with difficulty. After the procedure, I felt very strong resistance when I removed the sheath. Unfortunately, the tip of the sheath was broken like this. I inserted a 6-French sheath, and I first employed a 3-French forceps, but failed to retrieve. Only the radiopack marker was retrieved like this, here. So where's the tip of the sheath? You can see here. It's hard to see, and unfortunately go down to the popliteal artery. So under the distal protection using a tourniquet, I advanced their O14 wire into the tip and inflate a balloon and pull back to the sheath, but failed to retrieve. So I employed a biopsy forceps like this, tightly grasp their tip and successfully retrieve their tip. Nothing left behind. Second case, stack of wire and balloon catheter. You can see the occlusion of the AV graft of the dialysis patients. And balloon catheter couldn't pulse the lesion, and wire consequently collapsed into the brachial artery. So unfortunately, the wire was fractured when I tried to retrieve. So I inserted there another sheath from the AV graft, and a loop snare kit grabs the wire, which collapsed into the brachial artery. But their fractured wire was stuck in the vessel here. So I employed the biopsy forceps and captured the fluid devices and pull up. So the forceps was bent at an angle of 30 degrees like this. So biopsy forceps pulled out the fluid devices from the vessel like this, no injury. And it retrieved the failed devices, leave nothing behind. I'd like to show the fractured guide wire in the broken balloon catheter. The wire was completely fractured, and the balloon catheter was elongated with its shaft partly broken. Unfortunately, no injury to the vessel. You can see after the balloon angioplasty, you can see the successful recanalization of the AV graft. The last case, fractured IV support catheter. You can see the fractured catheter here, and you can see the stenosis of brachiocephalic vein here, and the tip was in the right atrium. So first I employed a snare, catch the end of the catheter, but failed to retrieve. Fail. So my boss whispered to me, use the forceps. So I employed the forceps like this, grasp the middle of the catheter and put down like this, successfully put down. Yeah, but at last, drop off. So finally, the catheter, I finally employed a snare here and tightly catch the catheter and put down to the sheath, femoral sheath, carefully and softly. Put down. So successfully retrieved. So in conclusion, may the forceps be with you. Forceps sometimes useful for retrieving the failed devices. Thank you for your kind attention.
Yeah, thank you. The first one in the stent was very, very okay. The second one in the foot was kind of okay. The third one in the right atrium kind of made my heart rate go up a little bit. because you really have to be careful. You know, in the stent probably is definitely very safe. In the leg, you know, you have some bailout techniques. In the heart, I mean, you really need to know what you're doing, because if you just nick the right atrium a little bit, it can be definitely a disaster. Why not try from the IJ, try to snare it or forceps from the IJ, just the part that's above, and then pull it up?
In their echocardiography test, there are some stenosis. Yeah. So it's
from what I saw, the stenosis was just and the kind of the tip of the catheter was just above the stenosis. You don't think that was enough to snare?
Exactly, yeah.
Wow.
Yeah.
Any questions, suggestions, comments? I know they use the forceps quite a bit to get IVC filters that are stuck in the vein. Again, that's a good technique if you're careful, and the venous system is usually low pressure, so if you do have a small perf, you can usually handle it. But these are good examples. Thank you.
Thank you.